everybody. So I'd like to welcome you all today to our conference with Luke and the team at Leeds on systems generated trauma. It's lovely to see the room so full, and thank you all for coming in this wonderful weather that we've got at the moment. And I do think there may be some issues with travelling. I don't know if some of you had some problems getting this, so we might have some few people coming in a bit late. So my name's Beverley and I work for the charity Cerebra. We've been funding Luke and the team for some considerable time now, I think over 10 years. So, and as a result of that, a lot of the research projects and the reports that come out of that have been funded by ourselves. And obviously we're really pleased to see that the fabricated induced illness report has got quite a lot of traction, I would be pleased to say. So obviously what today entails is really sort of getting you on board and sort of getting some ideas from you all, as I think it's mainly parent carers that are here today, sort of to get your views and ideas of how you can really sort of move forward some traction and really try to affect some change, some significant change would be wonderful. I'd also just like to make a few announcements with regards to housekeeping. There's no fire drill due this morning or during the day, but if the alarm does go off, the fire exit is just over there, and we're to meet by the large tree out the front. If any of you do smoke, you're requested that you smoke outside of the main gate. The toilets are just outside the door here, and there is a disabled toilet next door. I'd also like to thank the other sponsors, Fletcher's, who I'm not sure. Yes, hello, love it, and thank you so much. We really do appreciate your contribution to help put this on today. Thank you very much. Thank you. Also, just to say, we've got a Cerebra stand over here, which has got lots of information. We do lots of guides and information products, and we do have a couple of our legal rights team who are here today. So if you've got any questions, I'm sure they'll be able to help you. Or we do have an online referral form, so please do feel free to submit that, and maybe one of the team can get back to you and help you with any sort of help and support that you might need. There is a slight change to the programme. Professor Andy Bilson isn't able to present this morning, but he will be here for the afternoon session, so there is a slight change to that. As I said, we've got the report, and we've obviously got the conference today. Within your pack, we do have a draft survey that we're looking to publish at some point in the near future. I don't know, next week. So it would be great if you could take a look at the survey, complete it, and provide us with any feedback on that. That would be greatly appreciated. And you can hand it in to myself or Anna, or leave it on the front desk. That'd be great, thank you. Okay, I think that's all that I've got to say at the moment. So with that, I'd like to hand over to Elly, who's going to be our first speaker today.
Morning, everybody. It's really good to be here. Thank you for having me here today, Luke. I don't know everybody, but I know a few people, and I certainly know lots of people who are working around topics that are really close to my own heart. And I wanted to start just by talking very briefly about institutional ACEs, which is a concept we discussed in 2019 with very eminent Dr. Wendy Thorley, who's now retired. We were just thinking about things, when we're talking about ACEs at that point, ACEs was talked about quite a lot. There was a big movement, everybody was talking about ACEs, and we thought, yeah, but what about the ones that don't happen at home and the ones that don't happen with families? When we're nowhere near our children, when we're trusting them with institutions and spaces and places, what happens when trauma occurs then? So we felt this was the missing ACE. This was the ACE that's not in the current study that actually generates probably some of the biggest trauma that people can ever experience, and the ripple effect is absolutely enormous. If anybody's ever been through it, I'm sure many of you have, then you know what I'm talking about. So this is just really important that we raise awareness or get professionals to start talking about, if we're going to talk about ACEs at any point, particularly linked to trauma, we actually need to talk about all of them. And this is a really big one that we don't talk about enough. This is the one that goes under the carpet and that people don't really want to acknowledge. But it's really important because when we see the response in our children, we need to understand where it's come from, actually where it's coming from. So I'm sure you, like me, you've all got children, maybe, or many of you have children who are perceived as different being human, because humans are different and we are very diverse as a species. We always have been, we always will be. It's nothing new, even though we talk about it as if it is. Rising needs and all this, there's no such thing. There's just been a very diverse human population for a long time, going through an ever-tightening tunnel of a system that doesn't make room for everybody. So my daughter's perceived as different, but she isn't. She is the least of my problems. She's the least complex person I know. And she's not difficult. Once you know how to work with her in a humanized way, the problem is that the society and the system still narrate that she is the problem. And actually, that's the wrong way around. So if you flip it round and think about it, what society is saying is there isn't room for you because we've made the system like this. It's ones, it's zeros, you need to be A or B, you can't be Z or X, and you need to travel through in a vertical fashion and not make any problems along the way. But it doesn't work for anybody really. So this is where the issue comes from. We need to remind ourselves this is not our children and young people, this is the system that is broken and is not making room for the diverse population that we always have been and always will be. And this brings me to thinking about some of the amazing work from the Parent Carer Alliance. And you might be here today, I don't know, but I follow this work and I follow the work of Andy Bilson, obviously Luke Clements. And this is where I think it leads us to, is that we see a lot of safeguarding because people don't understand our children. They don't understand a life lived differently to the perceived, and I say perceived because it is perceived, norm, because there isn't such a thing at all. There are lots of lives lived very differently across our entire world in different cultures, etc. Having children with needs that don't fit in a system that doesn't accommodate them means that they are expelled from such a system and we are deemed to be the problem, or they are deemed to be the problem. So we're seeing an exponential rise in safeguarding and investigations purely based on the fact that our children don't fit whatever box the system has lined up for us, or whatever form that currently is in place. So we're left with no support, and the trauma, which is what we're here talking about today, is utterly devastating. I can speak from experience in terms of experiencing systems trauma, how much it affects you, how much it affects your children, your other children, if you have a child other than your one who is considered different, and then the wider family networks and support networks as well. It just keeps going out and out and out. And there's no support for that because we're still not understanding that this is where it all stems from. When we don't understand what we're looking at, we shouldn't be creating stories to park blame back in the place that needs support, which is the family or the young person. So difficult people are usually having a difficult time. This is a word I've been called a lot, difficult, because I challenge, because I question the system, because I actually want to know what it is my daughter can have, why she isn't getting it. And I like to ask a lot of questions. That often gets me into trouble. But it's just the way I am. I'm also deaf, so I'm misconceived quite a lot of the time, like many other parents, like my autistic friends. So because I'm deaf, I have very unfiltered responses. I'm quite black and white. I can't be bothered with fluff, and I tire very easily. And that makes me awkward, and there are lots of judgments and assumptions made about me as a parent because of the way I communicate or otherwise. Quite often, if I'm having a difficult time, everything gets shortened for me because I've only got so much capacity. If you think about the Mizraim spoon theory, I've got a certain amount of spoons and they decrease the more pressure I'm under. It's just human stuff, isn't it? It's not really difficult to understand when we start unpacking it because we're just having a difficult time. There's no need to label or say that we are hell-firing beasts or whatever they want to call us, because we're not. We're just human beings really struggling in a time where we actually need some help from the system. And this was really important to me because across 21 and 22 in particular, there were 6 spaces that referenced why things are not working. And this was Mr. Justice Hayden in a case in the family court in 2021. And it was really interesting. This jumped out at me because what he referenced was quite something for a judge just sitting there reading the paperwork around a family situation. And he actually acknowledged when you're looking at something that you don't understand, there isn't some kind of standard of gold parenting that we all have to achieve. It doesn't really exist. There is no badge for getting it 100% perfect. So we're not going to. And my kids are really good at reminding me I'm not getting it right. So I don't need anybody else adding to that. And it's really around this made up notion that we're supposed to achieve this bar. And I'm not sure what this bar is, and I'm not sure it really exists. But when you're being supported by services, it feels as though you're constantly being measured against this invisible unknown bar that we all have no idea what is, but it's there in the background. It's quietly there. And it's interesting this judge recognized that as this fabricated gold standard of parenting. Actually, what we're looking at is people having difficult times really trying to do their best. That's all it is. And we've got to widen our lens and think about it slightly differently. And I came across this the other day again. So Steve Broach, many of you will know Steve Broach, the KC. So he, back in 2018, had reminded everybody disabled children are not children at risk. They are children in need. There's a very big difference. Children in need are not receiving services because they are in any kind of safeguarding position or risk. They are in need. It is the law, and it's kind of mixed up and mashed around and not understood enough. Children at risk, unless there are other risk factors present. And he said it was, timely reminder to use James Mumby's best line, which I absolutely love, is to remind the state that it is a servant to those with additional needs. It is not the master. And I think what we've seen over the last 10 years, particularly with austerity, and I really hope with the shift in government this is going to change, but we have seen a tightening of the space, and we have seen more trauma, more toxicity, more families being lost along the way, more young people being lost along the way. And it really needs to change, because that is the role of the state. If somebody is employed by the state, they are a servant to the people. They are not the master. So why do we need to keep our curiosity? Well, I am the eternal optimist, which is another big flaw of mine. It really annoys people because I'll say all the serious things and then I'm like, but we've got to have hope, because we do, because I couldn't survive if I didn't have hope. My daughter is the reason. So she is utterly present and joyous every single day, regardless of what she's been put through. She literally rocks up to every day with, right, let's do it. And I think that's really important, that we remember our children are able to do this far better than I'll ever able. I'm rubbish at it. I can have really dull, awful days. I'll sit with her for 10 minutes and I just want to stay in her world all day, because it's much nicer there than the one we live in. Because she's kind and empathic and compassionate. She's really human with everybody that she meets. She doesn't pick and choose who gets and who doesn't. Everybody gets a part. Everybody's got a space. So our curiosity is really, really important, because I think we've lost professional curiosity. We've lost curiosity about what it is to be human. We've lost curiosity about one another. We are polarized. We are in extremes, which is dead easy, by the way. And we need to come back into the middle human space that Rumi talks about, the field, where the human work is. And we need to start mending this for the sake of our kids. That's going to mean a lot of us are going to have conversations with professionals that we really don't want to have, that we really would like to say what we'd like to say to them. But I would invite you to not do that. I would invite you to meet them in the middle and be the bigger person. Because I think that's how we create change, when we put down swords and we start to do things differently. It does not mean that we're saying it was okay. But what it means is we, like my daughter, take the higher position and we say, actually, we think we should have a conversation and we need to do this differently. And I'm willing to work with you if you're willing to work with me. It starts in the human middle. And I also think, as Norman Lamb so much missed, that man, he really is, because it is not an optional extra that this happens. This is absolutely imperative. It's at the heart of everything. We have got to stop smacking each other around the head because we're not getting anywhere. We've done a decade of cycling back round the same stuff in a different form every time, and it requires we do something different. So different conversations lead to different outcomes, but I think we have to be willing to meet in the middle. I know that's not where everybody is, and I totally appreciate on a journey where you've suffered pain and discomfort and trauma, that might not be where you end up. But for some of us it is, because we want to try and do it differently. So I just think, as Norman said, it is an absolute imperative that this starts to happen. And then I had to think of things that Ella would make me think of, because Ella is the biggest life's eternal optimist, and I'm like in training behind her. So what could we do if we do it collaboratively? And I have to say, I prefer this word to co-produce, because collaborative is, it feels more humanized. We need to step away and do something different with different language. And I think we need to think about keeping our kids front and center. We've got to stop this acting at crisis thing. We talk about it, we spend a load of money getting, well, we don't spend the money, we get to crisis, then we spend twice the money getting out of crisis and a bit more to put it back on track. So if we'd actually started at the point prior to crisis, we'd have saved a lot. So it's thinking about, it's not just the human cost, it's the financial cost. It is about building trust and being authentic, because our kids, I don't know if you're anything like my daughter, but she can spot inauthenticity off, like a mile off, like before you've even got through the door. She can sense it coming. Yeah. So being accountable and owning it, encouraging professionals to actually start being accountable again. It's all right to screw up if you apologize and if you say, I made a mistake. Like, we need to do that stuff with each other again. We need to say it's okay. You're not going to get it all right, but could you please own it when you get it wrong? And I'll do the same. And these are the human conversations that we really need to be having. We need to remember, obviously, one size does not fit all, because nobody is the same as the next person. There's not one human on this planet that is the same as the next. And it's about being equal, remembering to value everybody. Our kids have the same rights to all the human rights everyone else in the world has. It's not different because you have a disability or a difference. It's exactly the same. So we need to get back to that level playing field. And we need to really think about our language, and we need to flip it to a positive. And that's as much on me as a mum, remembering to not always talk negatively about my child and not always talk about the bad stuff, because she needs me to talk her up. She needs me to talk her position in the world up. She needs me to make sure that people hear all the stuff they're missing when they don't value her as a person appropriately. And really, at the end of the day, because Luke said keep it short, so I have, as short as I can, because I'm a talker, as you can tell, is that we share one label, regardless of all the others. Every other label, this is one we all have. We're all human beings, and we all deserve a place and a space in this world to be treated fairly, equitably, and not have to be traumatized and punished and abused by the system, which is what we know is going on a daily basis. It's not acceptable. It does need to stop, but it starts when we meet in the middle and acknowledge each other. Yes, we're different, but we're also the same. So it's how we treat each other humanly going forward. Thank you very much.
Thanks, Elly. Thanks very much.
Here.
Oh, thank you very much. I'm Elly Clements. It's my pleasure to, with Anna, do some of the research that we're going to be talking about today with other colleagues. It's my huge pleasure to see so many wonderful people here, intimidating people who collectively are doing such fantastic stuff. So that's something that I'm really thrilled to. And if I don't recognize your names and faces, as soon as you tell me who you are, I will remember, because when you get to my age, that's the bit that you remember, the rest you forget. I'm going to speak hopefully for only about 15 minutes max. We'll have a short 15-minute discussion. We're trying to bring the program a bit forward so that we can allow a bit more time after lunch when Andy, who should be speaking in this session, will be here. He's just the most wonderful person doing incredible stuff on data. So we want to give him some time, but also allow as much time as possible. Oh, sorry, I've got this, haven't I? Is that any use? Yeah, okay, I'll do that. So that we can have ideas about how we're going to change the system, because that's really where we're at. Cerebra that fund this, Beverley has introduced the session, is an extraordinary charity in the sense that it has an advice team who work, brilliant advice team and information team. But they're not just giving advice to individuals, they are collating stuff to say, well, look, and they say to Anna and myself, this is a commonly occurring problem. This is a real issue with disabled facilities grants and all that sort of stuff. And this is a problem with direct payments. And this is a problem with parents asking for help and then a social worker coming in with no warning whatsoever, insisting on seeing the child alone, who is neurodivergent and doesn't like that sort of stuff, and then insists on seeing the bedroom. And I feel that I'm being violated. I feel being humiliated. I feel in all of these interactions that I wish I'd never ever asked this agency that exists to help me. I don't want anything to do with them ever again. And that's repeated within the NHS system, where somebody said, look, I'm not happy, I'd like a second opinion, oh, I think this perplexing presentation, you know, and all of those sort of things. So these are things that the Cerebra team flag up as big issues. And then Anna and I and 50 students each year then sort of seek to analyze why this is happening, if there are a legal reason, because we're coming at it from a fairly unusual direction of the law. How prevalent is it? And what the hell are we going to do about that in terms of just changing the problem at root causes rather than just giving everybody individual advice, but actually changing the system? And I think over the years, some of those things have really succeeded. And there's lots of people in this room that we've worked with who have been an inspiration to us. So what I want to do is to do two things. I'm just working out which order. I'd like to provide some quick feedback on where we are with our research program, particularly on parent blame and fabricated-induced illness allegations, and then quickly summarize what I understand to be what we have coined to be the phrase systems-generated trauma, which is really what Elly was speaking so eloquently about the fact that it isn't the trauma of, you know, people are traumatized by childhood experiences, by mental health difficulties, by domestic violence and things like that. But for many people, the most traumatic experience they ever encounter is dealing with a system that was theoretically called a social welfare system. And that's got to be recognized. And I think today is a sort of start of a campaign to make sure that we drive that into the guts of every public organization and changes their culture, because that culture denies the trauma that it's causing. So I was going to finish with that, but I think I've just said it. Cerebra start picking up this idea that parents are being traumatized when they ask for help from social services. So we did the research on this and said, well, why are social workers who go into this profession wanting to do good, wanting to make the world a better place, suddenly doing these quite incredibly intrusive things into people's lives when they haven't got an iota of evidence to say there's any abuse or neglect. Why are they doing these things? And very quickly, we realized that the problem was with the legislation and with the guidance and with the obsession. And of course, we should be obsessed about child homicides. But the number of child homicides, despite draconian legislation since the 80s on child protection, the numbers haven't changed. About 5 per million are murdered every year. And that hasn't really changed for the last 40 years. But what has changed is that families are beginning to be looking to an organisation that used to be, I think, when I started out as a welfare organisation, as now a surveillance organisation that you know, a lot of them wish that they had never sought help, but that many people just don't have a choice. They need that essential support from the state. So we looked at that, we identified the problem occurring in about 2013. This is after the Victoria Kimberley inquiries and all the other high-level ones, Jasmine Beckford and so on. And the government just defining, as the law does, unfortunately, children in need. So social services don't have any obligation towards poor children, disadvantaged children. They only have this obligation to children in need. And the Children Act fatally lumped children in need into 2 categories. 1, risk of abuse or neglect, and 2, disabled children, all disabled children. And then the government in 2013 only gave 1 assessment protocol for children in need, and that was, you've got to inspect the bedroom, you've got to look at this, you've got to do that. So you get a sort of cultural conditioning, a narrowing of professional ability in the way that Elly's just described. So having sort of identified that, and then you've got this managerialist culture of top-down, hitting targets, Ofsted and all that jazz, you get really quite poisonous organisations, not all of them are, which are not pleasant for families, but they're not pleasant for very many frontline workers at all either. So we've been looking at that. So that's interesting. We diagnosed the problem to a degree, but what we're really interested in, what Cerebra is really interested in, is changing it. You know, well, it's all very clever to publish a report on this, but how do you actually change that system? Quite a few colleagues here, Anna and I and a few other colleagues are writing a book on this in a way, which will be out attractively priced from Policy Press next year. We've had high-level discussions with the Department for Education. They get it. The chief social worker gets it. They talk the talk. They always talk the talk. High-level leaders in social services, they talk the talk. Yeah, we get this, we get this. But nothing happens. We've got Asma. Is it Asma from the Pathways Project at the DFE here today? So we're having high-level. We've got really good. Sorry, yeah. How do you pronounce it? It's Amna. Sorry, I told you I was useless. Amna. So we're really wonderful that you're here. The DFE seems to be, in one way, getting it, which is great, and in another way not. We pressurised to change the central government guidance for working together. We had a commitment that that would be done. It wasn't done last year. We had a commitment effectively that it would be done today, to say there should be completely separate regime for disabled children, and beginning to stretch those out. We've Elly gave you a quote from Lucy Fullard, who I hope is online, from Gloucester. They have done some great work in developing a separate assessment template, one that focuses on needs, not risk, very much focusing on the adult system. Really brilliant piece of a template, which they have sort of digitalized as well. So when the government says, oh, it's a bit difficult, we can say, well, actually, this has already been done. We want to have completely different guidance about the way you approach an assessment with a disabled child and their families, from one you approach one with somebody you've got cogent evidence of abuse. And last year we published a draft guidance which we collaborated with, to use the right word, with a number of parent care organisations. I mean, they wrote it, we were just the scribes. And you know, the first overarching principle is appreciating that an assessment of a disabled child's needs in a situation where there's no evidence of abuse requires social services to think and act differently compared to when they're undertaking assessment. The importance of beginning with the assumption that parents are best placed to judge the well-being of their disabled child. Appreciating that many parents of disabled children feel that their expertise regarding their child's well-being is not always recognised. So it goes on through that, and it's just, you know, I've yet to come across anybody in social services that could disagree with one line in this. So we have the draft guidance that we think that for education should adopt. We've got the draft template. If that doesn't work, we have sort of publicity strands to the work where Cerebra particularly, the advice team is working with the Law Commission, because the Law Commission has now announced that it is going to review the law relating to the rights of disabled children. And what we're saying is that the Children Act is fatally flawed. It shouldn't conjoin disabled children with children at risk of abuse. It needs to go into complete separate. So the Law Commission will publish its provisional report next month in August, and I'm always wrong, but I'm quietly hopeful that they get that. And if they don't, well, we'll make sure that they do eventually get it. On fabricated and induced illness, again, that was something that was flagged up very heavily by the number of parents and carers and families we deal with, and also by the Cerebra in-house information unit. It was something that we sort of almost steered clear of for a while because it's just too big an issue, I think, for a small research team like Anne or I to take on. And in one sense, we were right. We are overwhelmed with that issue. And it was a very difficult issue to research because local authorities and everybody the number of organizations have tried to have research on this. A number of media companies, television companies have tried to do freedom of information. And all of those information requests come back saying, we don't have any FI, or we're not going to tell you, or a combination of those. And they still like that. So we're getting an official line that FII allegations are very rare. Of course, FII itself is very rare. But we get huge numbers of families saying that they have had their lives devastated by those allegations. We've drawn hugely on some really inspirational research from Fiona, who's here, from Andy, who's going to be here this afternoon, Kathy Long, Judy Eaton, and other sort of amazing researchers who have looked at this with a very sort of critical, analytical, academic eye and said, look, this stuff stinks, basically. It's going to have a severe discriminatory impact on disabled children, but parents of disabled children, particularly neurodivergent parents, and have come up with a lot of these sort of indicators. So what we did is we did sort of some qualitative research, but it's also had a quantitative element that showed that on the face of it, 4 times as many children, parents who are disabled are accused of fabricating induced illness compared to parents that don't have an impairment. Well, there's no research to show that neurodivergent parents are bad parents. So why is it? And of course, that had already been predicted by these sort of eminent researchers. So we now have hard evidence, and the Quality and Human Rights Commission is now very interested in this and has asked us to do various things, which we are going to do in the process of doing, and we will do next week, one of them, which will be quite interesting, which I'll mention. But basically, we're asking the Royal College that has issued this guidance on fabricated induced illness and perplexing presentations to immediately withdraw it. How can you, knowing the trauma that this guidance is causing, and knowing that it is, on the face of it, highly discriminatory, persist with it? No reasonable public body could do that. It would be unlawful. At the moment, the runes aren't very good in the sense of what the response is going to be. But there is litigation going on. Some of you are involved in that litigation. Some of the speakers are involved in that litigation because this does not only breach the Equality Act, but it also breaches the European Convention on Human Rights, which is not likely to be abolished anytime soon by a Prime Minister who wrote the leading book on the subject. We do think it will come litigation, and litigation is something that we have. We do try and engage in conversations. We do try and change policies, but I think that this will come to litigation. At the moment, what we're thinking about perhaps is crowdfunding for that litigation. There are so many thousands of people that have had their lives devastated by these sort of casual allegations, which are risk-free. You can just say it, there's no comeback at all. That and so some of the people that are considering litigating are also considering about crowdfunding. I think the chances of success of litigation are very high. So it has all those promising aspects. We are very heavily in trying to involve the media because, as we see from the post office scandal, a very similar scandal, the media can do everything. And we're also very interested in the data protection issues that families, once accused or once something has been raised, it is never erased from their records, and it pops up every time you go to see a GP or a social worker or something like that. We're doing some really detailed work on that, and in relation to media and data protection, which we should have a leading counsel's opinion on fairly soon. I'm working with David Lawrence over there, a great friend and supporter, former chief executive of the Disability Law Service, now campaigns organizer, a magician, to do that sort of work. So, you know, that's another thing to watch. But the data protection is a very big issue for many families that have had these appalling things done to them. Above everything else, really, I think it is up to us all, to all of you, because nothing this would happen without your voices eventually being heard effectively, not by the state, but by some incredible researchers and by Cerebra, who, without that, we wouldn't have any of this. But unfortunately, it is a battle that, and it is a battle. I'd love it to be joyous and huggies, but it's going to be a struggle. It requires you all to do it, to persevere, I think, is what will come out of it. So after lunch, we'd like very much to have a discussion about what can we do, practical ideas. We have got a few up our sleeves that we're gradually doing, but we want your ideas.